Welcome to the Auburn Medical Group YouTube live stream, the entertaining medical live stream where viewers can ask real-time questions of real medical doctors. And here are our hosts, Dr. Mark Vaughn and Dr. Gwen Vaughn.
Welcome to Auburn Medical Group live stream with... Oh,
me.
I'll show you who it is. It's there.
Oh, hey, that's me.
That's pretty cool.
Dr. Gwen Vaughn.
And Dr. Mark Vaughn. And you also can be a part of the show, like Lindsay and Twine. At the end, we put the names of the big contributors somewhere over where Dr. Gwen is sitting by using this Patreon link that's going by. See that? Isn't that cool?
Look at that.
Interactive graphics. Live. So we do welcome you to the program, and we are glad you joined us. We're going to be talking about RS...
I'm on the edge of my seat.
It was your article.
I know.
Okay.
I know what it is.
So Dr. Gwen wrote about RSV, or respiratory syncytial.
You could say it.
Respiratory syncytial virus
Syncytial.
on his blog, drgreenknight.com. There's a link in the description, so you can go to that very post about respiratory syncytial. Very personal account.
It's right.
His family experience.
Yeah, I have had personal experience with RSV with a child of mine. So.
Yeah. All right.
Yeah.
So did I tell you to ask me about... This is distracting, so I'm going to take it off. Did I tell you to ask me about something today?
Yeah, I was supposed to ask you about the song of the day.
What's the song of the day?
What's the song of the day?
Cold Cadaver. Anybody know it?
Cold Cadaver.
Lindsay, do you know this one? I would expect you to know this one.
Like
because you probably on Spotify put in search terms like cadaver.
What kind of music do you want to listen to today? Cadaver.
Cold Cadaver. So
Cold
Cadaver, 2018, maybe it's 2015, by King Gizzard and the Lizard Wizard.
Ah.
Cold Cadaver. And I'm not sure. I sometimes Spotify will give you the words to a song. Have you ever seen that?
Yeah.
I think you even saw it with King Gizzard last night, if I'm not mistaken.
Yes.
It doesn't do it for this old album by King Gizzard and the Lizard Wizard.
So you got
It sounds like the line goes, Cold Cadaver, cute daver.
Okay.
Like a cute cadaver? I'm not sure, which makes me think Lindsay would be even more interested in. And I know she's here because I'll show you how I know she's here. Because the chat, I have a way of showing the chat. There is a way to do it.
You can do it.
You can do it, Mark. You can do it. There, Lindsay Antwine
made it.
Says she made it. And of course, Rusty Bernard is here too. He's hoping Mr. Ed's here. Do you know where Mr. Ed is? If anybody knows where Mr. Ed is, please let us know, because we don't know where Mr. Ed is.
Gosh.
And Candace says, how long are toddlers contagious for?
Great question.
Ending a sentence with a, is that an article?
How long are toddlers contagious?
Also, can they get
with RSV, I would
reinfected?
imagine.
Yeah. We should probably answer questions like that.
Great question.
Do you want to do it now, or you kind of go through a thing where you get to that part?
Go through a thing.
He's got an order to this. So we'll get to that. Thank you for the question, Candace. And Tracy Orpin. Tracy
made it. Hello.
Tracy made it while we're live. Tracy, I'm going to tell on you.
She's here.
I'm going to tell everybody about Tracy. So Tracy, every once in a while, comes across our channel and gets caught up on all the videos that she hasn't commented on yet, and says she's sorry she missed us.
We appreciate you catching up.
Yes, Tracy, we see it when that happens, because we see all the comments. And so we know when you're getting caught up, because we'll get like 10 of them in a row that say the same message, but it'll be customized. Like if it's a show that Ed is on, she'll include Ed.
Yeah.
Yeah. So Tracy,
you're paying attention. We appreciate it.
You are definitely one of the most closest followers of the show. At least we can tell from the comments. So
all of the rest of you,
you've
got your marching orders.
Keep up with Tracy Orton. Okay, and Lindsay Antwine, you guys are making me sound so
with tears
of joy. I don't. Okay, what's the emoji look like so that the tears are tears of joy and not tears of sad? Oh, because it's smiling. Gotcha. Yeah. That's how the computer knows it's tears of joy.
Different from the one that's sideways, which is rolling on the floor laughing.
And I don't know. Thank you, Lindsay. Yes, we. Okay, so anyway, Tracy, not Tracy, Lindsay. Cold Cadaver by King Gizzard and the Lizard Wizard. And they do have some stuff that you would like. Not just a song by that title, but there's one album that's totally screamo death metal.
Awesome.
Unique from their other music, which you heard some and you'd say it definitely was not described as that. It was much more mainstream. My kids love them. They follow them and go to their concerts in different states. It's kind of funny.
Yep.
The Cold Cadaver song.
Yeah.
I'm wondering about. Okay, what's your experience with cadavers and temperature?
They were room temperature? I mean,
but for somebody who's keep them in a refrigerator because they're not preserved.
Yeah. What we had were preserved. Formaldehyde.
Fleshed out the blood with formaldehyde into the vessels and infused them. They keep them cold. So this is not like the medical student song about cadavers.
No, not for us.
Our song would probably, rather than temperature, it would probably be something about the smell. Yeah. So I started gross anatomy in medical school, wearing gloves every time.
Yeah.
But they just got in the way. And so I'd come home and the spouses of medical students will tell you about this. See, were you married during your first year of medical school?
No.
Okay, so you didn't experience this.
Nope.
The spouses will talk about how their medical student comes home and reeks of formaldehyde.
Yeah.
And I wouldn't wear gloves, and nobody did where I was going to school at that time. You just get tired of them. They don't really seem to be contributing anything with the cadaver because it's already preserved. And
right.
Are you going to catch something from a cadaver?
It's been injected with formaldehyde. What are you going
to get?
Catch?
Fungus?
Yeah.
That's if you don't keep it covered.
Yeah, right.
Yeah, which happened to some of them, by the way. Yeah. But not ours. Ours was well kept. Yeah, wasn't cold. It was room temperature.
Yeah,
and
ours are room temperature.
Smelled like formaldehyde. And after a while, you kind of get. I mean, when you first walk in, your eyes are burnt. Did you ever have that? Did you ever have your eyes burned when you walked into cadaver lab?
Oh yeah.
Because it's so strong. All the cadavers filled with the formaldehyde. And if you've never smelled formaldehyde, we'll have to come up with a way for you to do it. I don't know where you would, but how would a civilian?
High school biology class?
Okay, that could be.
Because that's the other place where I had experience with that, with frogs.
Okay, and Lindsay also says, I know plenty of old school funeral directors who used to embalm without any PP. Well, now that's different. That's different because they're not embalmed yet.
Yeah.
When they're working with them, they're completely embalmed when we work with them.
Right. Yeah. It's already, the process is done. Yeah. But while you're embalming, if they died of an infectious disease or something, there's still
there could still be something there.
That you could catch something.
Please use PPE when embalming. All of our viewers, please, when you're embalming a cadaver,
our public service
use
announcement
PPE.
for today.
We feel strongly about this. Yeah. PSA. That's a good way to put it. This message brought to you by somebody who didn't embalm with PPE. No, we did. Well, we never did.
We were already embalmed.
We did not have to embalm our cadavers. They came pre-embalmed. In fact, I always have this joke about people who go to medical school outside the United States, and it's horrible for me to say this. Probably borders on unprofessional. I hope the state board will forgive me. I guess it depends on if anybody in the state board went to medical school outside. I used to always say that provided our cadavers, we didn't have to provide our own.
Oh, yeah.
Okay. Maybe I should move on. Maybe I should apologize so that I don't get in trouble for that. Would that help?
Sure.
I should show that there's a change of heart in going forward, that I don't joke about obtaining your own cadaver in the future.
That is inappropriate.
Unprofessional, I think.
Unprofessional.
Yeah. That's what gets people in trouble.
Ridiculous.
I went to a conference that had an attorney speaking about social media and doctors, and mostly it was residents who were taking pictures of themselves while drunk or taking pictures of themselves with their cadavers.
Oh, yeah.
Highly inappropriate.
Yeah.
That
was something they specifically talked about.
So she was talking about how do you decide what you shouldn't do on social media that may impact your future career. And she played that clip of Dwight Schrute saying, "Don't be an idiot."
I don't remember that.
Whenever you're going to do something, ask yourself, would an idiot do this? And if the answer is yes, don't do it.
Don't do it. That's
good
advice.
Don't be an idiot.
That's good advice. Truly.
Okay. So let's go ahead and begin our talk on
enough about
respiratory
the pregame.
syncytial virus. This is the kickoff. Like
RSV and bronchiolitis. Yeah, of course.
Yeah, that's the kickoff.
Who doesn't play? Actually, my kids just figured that one out. They know how to play now. Making the cool little...
Make the little field goal
for
the other guy.
Yep, hitting it across.
Yeah.
Respiratory syncytial virus is a virus that can affect anybody. However, it is a big problem for infants, and that's where we get all of these ER visits. So in America, at least, and this may be in other countries too, but in America, currently there is a huge influx of RSV cases in our ERs and ICUs. And this has been on the news, it's been all over, and RSV causes a condition called bronchiolitis. Bronchiolitis is pretty much isolated to infants, typically in the first 6 months of life. Reason being is when you get RSV, it's any other respiratory virus. In most people, it gives you some cold symptoms if you're an adult. If you're a young child, maybe a little more severe cold, but you're able to get over it. But in little babies, they've got really small airways, and those airways can start to produce mucus, and that's the problem. You can start to get what's called mucus plugging, which can block air from going all the way through those airways down into the alveoli to get blood or oxygen into the blood, and that can create hypoxia. And that's where we have the problem with bronchiolitis, which is caused by RSV. So that's essentially what's going on and why all these little ones are so susceptible to it. Why is this happening now?
Oh, wait. So you just covered. Oh, look at
what happened there?
Look.
Help. Hey, thank you. I'm going to look and see what that's about.
Barzyk. I had to interrupt because I noticed you were done with the...
just the pathophysiology.
With the pathophys part of it. So now we're going to get into kind of the contemporary why now.
Why is this happening? Why have we never heard of this before?
But first we had to thank Laura Barzyk. Yeah, she did a super chat. Thank you, Laura Barzyk. We like that. It goes to support our Dutch brothers habit. So you're contributing to the delinquency of a physician.
Awesome.
And we did have our Dutch brothers. We just had it earlier today because earlier better.
Do you notice? No.
It's working.
We're much more animated.
We did have it though.
Yeah.
Okay.
Yeah. Cool. Thank you for that. The pathophys. So why now?
Why now? Why are we having so much respiratory syncytial virus this early in the year?
Right. That's the other thing.
Or late in the year.
So this goes back. RSV every year is a problem.
Around January is what I remember.
Yeah, usually December, January is when it kind of spikes. But we're only in October, and we're already seeing this huge influx into our ERs.
Why?
Why is this happening?
Why? Who knows why?
Yeah. I see that hand.
Do our viewers know?
In the back.
In the back.
Can anybody? Yeah, I'm curious.
Let's give them a second because there's a little delay. And while we're waiting, we will see what it was that Lindsay Antwine threw in just a moment ago about the Peter Lorre and Vincent Price movie where the Victorian era morticians have to provide their own cadavers.
I haven't seen that one.
Missed that one, but thank you.
There you go. I would imagine that would be an interesting.
Oh, and we should also actually put up Laura Barzyk's question or comment too.
Right.
Which was, well, now I'm really sorry. I'm late. I missed the beginning. We're talking about respiratory syncytial virus, and you missed it.
So you reached that part. You came in right as we were starting to talk about RSV and bronchiolitis. You missed the pregame where we were talking about
Did this program used to not show super chats like that?
I don't.
That's really cool. It shows the amount.
Nice and orange.
I think this is new.
And oh wow.
Do any of you remember? Did we used to be able to show super chats looking like that? That's pretty cool. I like it.
Well, I'm not seeing any answers to why this is happening now, but
go ahead.
It's like Sunday school where the answer is always Jesus.
Why is RSV happening in October?
The answer for everything these days is COVID.
Oh yeah, okay, I get it now.
Get it?
COVID is always the answer.
Yeah. So so for the
say it with me.
What's why? COVID. Yeah. So it's the pandemic. So for the past 2 years, 2020 and 2021, we've been having our masking, our
say it with me. Heller.
What?
He's a weapons designer.
Oh, okay. All right.
Keep going.
Anyways, so we have not seen as much of it in the past 2 years. So kids just haven't been as exposed to it. So now that essentially the pandemic is reaching this new phase where we are no longer masking, we're back in schools without masks, and
So you're blaming it on
normal.
school age individuals.
Well, that's probably where a lot of it gets transferred, and then they bring it home to their little siblings.
Little siblings.
Yeah, I mean, parents can do that too from work. That's actually how I brought it home, probably to my child. That's why. So we have this 2-year gap of where none of these children have had it. So there is a immunity gap, is the term that they're using, where no one's gotten it. So we're all susceptible, and so, well, not we're all, but all the kiddos are susceptible, and they are getting it and giving it to the little ones. And again, that's where we have the issue, because they're the ones that cannot clear it as easily. They get the mucus plugging, the hypoxia, and need to go to the ER and have ICU support sometimes a breathing tube for them. So.
I am not sure if Candace already heard it or if she said it and then we got it later, that she knows that it's because of the kids running wild. No, viruses are running wild.
Yes. Yeah. So it's not just RSV, but RSV is one of the ones that ends up has kids end up in the ER. I mean,
that's one we're seeing right now.
Flu is going to be like that too, likely.
Other things,
and other viruses as well. So.
Because we had to reach a time in history when we were without masks at some point, and
and it was going to catch up with us. So that's what we're seeing now. Now RSV is like any other virus. It is not helped by antibiotics. It is
sometimes viruses are helped by antivirals.
They are. Yeah, we don't have one for this.
Unfortunately, there isn't one.
Not have an antiviral for this one. Yeah. So it is essentially supporting the body as your body fights it off, and it does. RSV, fortunately, is rarely deadly. However, it lands kids in the hospital a lot, mostly for oxygen support. That's the big thing, and suction. Suction is kind of a big one. They get these all this mucus in their upper lungs and posterior nasal airways or nasal passages, and you just got to suck that out. And you that little bulb syringe that you had when you were taking care of your kids, it's not always sufficient.
The booger remover.
The booger remover.
Now I noticed something. This is what I contribute. He contributes very accurate current medical information and practice. I contribute an historical perspective. I remember when we would give them racemic epinephrine. And steroids.
Right. We do not do that anymore.
And since the days of my residency, we've had studies that show,
it doesn't do anything.
Outcome isn't any different whether you gave it or not. So
we're seeing, and even the same with albuterol. Sometimes it's practice to use albuterol or nebulized albuterol in these little ones to try to open up those airways a little more to allow them to breathe. However, the studies don't really reflect any improvement in their long-term course. They still have
unless they had something else going on that would have been used for.
Right.
But if it's a kid who doesn't have asthma, who's having RSV,
right.
Who doesn't have?
And these are young ones.
What was the other one? Physiotherapy, where they hit them on the chest.
Yeah. Oh, they used to have these vests.
Babies.
Did you ever see those vests that like just shake?
I've heard of them. I never saw them.
Doesn't give you shaking baby syndrome. But they just kind of
shake their head,
shake their chest. It's like. Brrr. Yeah, I remember those.
Yeah, they tried that. But if a child has CP or CF, cystic fibrosis, spelled with a P, not PH. Or F, not PH.
Oh, CF.
CF. Then you would use that because you're treating the cystic fibrosis. But for RSV and a child that doesn't have cystic fibrosis, you wouldn't use that.
Yeah, right. So fluids, oxygen support, rest, and love, holding them close.
Yeah.
I remember, and you can go read my account of it, literally holding my child for hours over a humidifier just so he was breathing in that humidified air, trying to break up those thick secretions. There's actually a picture.
And what appreciation do we get for it?
Yeah, I know. He's a wonderful boy now.
So another comment. Laura Barzyk says, heard cadaver.
Oh, yeah, that's why you came in, and that's what you missed. Yeah, sorry, we got to move on.
So we have to rewind for Laura.
You'll have to watch that first part
because
of it.
Because she didn't hear us talking about, there's a song called Cold Cadaver by King Gizzard and the Lizard Wizard from 2015 or 2018, I don't remember which.
That was the song of the day. Why?
And we're talking about why is it cold cadaver and not warm cadaver? Because it's by somebody who is in a morgue rather than an anatomy lab. That's what you missed, Laura.
Yeah.
So You do super chat, we'll rewind for you.
We'll do it for that.
Yeah.
We'll do it for that. Yeah.
And then
we're easily.
Candace writes, what is your take on toddler receiving COVID vaccine? I plan on getting them their flu vaccine this week. Not sure if I should add on a COVID, ages 2 and 5. Hey.
Oh, yeah.
Let's answer that question.
Great question. So it's only recently that it's been approved down to that age, down to 6 months and older. It was only down to age 5.
And that's just the Pfizer.
Exactly. Yeah. And I don't have. My child is 5 and older, so I don't know if it's the new bivalent one, but I would imagine it's. I don't know if that one's been approved for that age yet. I
have not seen anything about the bivalent being approved for the younger age group.
Yeah. So that one is a little difficult just because this Omicron variant is so it evades vaccines so well. Fortunately, it is less virulent, not as deadly. My 5-year-old got her COVID vaccine as soon as she was eligible. So that goes down to at least 5 years old, down to 6 months. It's a little more difficult because as you get younger, it's less likely that they'll have a bad outcome. So the official CDC recommendation is absolutely get that vaccine. I have conversations with parents about it and go through the benefits versus the risks.
Right.
As far as I think there was questions about or the underdeveloped immune system that Lindsay put on there at that age. No, that's something else. Sorry, I was reading something else. But absolutely a flu shot. 6 months and older, no question. Get your flu shot.
And I would still recommend even the old COVID, even if it didn't have the update, just for
we'll give you a little protection.
The protection it gives is against hospitalization and death.
Right.
Not
very
safe.
It. That's the good news.
So
these have been tested.
The downside is very, 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 very small.
Yeah.
Very extremely small compared to the benefit. If you were to be that, and it's still small. The chance that the child would be injured by COVID, but in comparison to the chance they'd be hurt by the vaccine, it's enormous.
Right.
Yeah, that's something that's lost in all this talk about the vaccine and possible adverse effects. We don't want to say there's no such thing as adverse effects, nor do we want to discourage people from reporting them if they do have them. We want them to through the vaccine adverse reaction
layers database. There's no
vaccine
DNA.
Adverse effect. Anyway, VAERS.
Yeah, that's what.
We do want you to report if something happens, but the numbers are showing that even still, the benefit is much on the side of getting vaccinated versus not getting vaccinated.
Yep.
But you have to look at big numbers to see that.
Yep. So Lindsay does ask a question about steroids in babies. It's a great question.
How did I miss that?
So if steroids suppress the immune system and someone with an underdeveloped immune system is given them, doesn't that hinder the job of the system to fight the virus?
Now, are you talking about babies who we don't give steroids to anymore, or are you talking about somebody else?
Yeah.
Lindsay, are you talking about somebody else?
I would imagine it was your comment on giving steroids in the past for
like we used to,
for RSV.
Anyway, anybody who's got the steroids on board, the corticosteroids, you are immune suppressed while you have that. You are more vulnerable to certain types of infections.
Yeah. And there are some times where we give steroids because of the benefit outweighs the risk. For example, croup.
Oh yeah. Well, even COVID.
And COVID,
when somebody's hospitalized with COVID.
The croup is the common one that's been around forever that causes that high-pitched barky cough and the swelling when it gets to a point. We don't do it for everyone who has croup, but when it gets to a point where the breathing is difficult through the night and in a moderate or severe category, we give steroids, a one-time dose steroid, because we know that will reduce the swelling, and that reducing the swelling is much more important than the mild detriment it may make on fighting off that virus.
Yeah, they're already infected with something. They're already sick.
Yeah.
So we can make an improvement in that.
Right. Yeah. So there were some questions about how is this transferred? What is it? How long are kids contagious for? It's a lot like your normal cold, actually. So respiratory droplets, which can be, you can get those through air transmission. So if you someone were to cough around you and you were to breathe in that air, or even get it on your hands and then touch your face or eyes, any of your areas that open to your system. That's one way. The other way is if those droplets fall on something that you then touch, then that you can get that way. So doorknobs, what else? Pencils that we're sharing.
We were just talking about doorknobs just last night, weren't we?
Yeah.
And bathroom doors you can open with your feet instead.
Yeah.
And air dryers
Blowing
that
things
you
around.
use to dry your hands, not to use instead of the urinal.
Right.
Yeah.
So typical course for RSV is 10 to 14 days. The kids will get worse over the first half of that and then get better over the second half of that. So about a weekend is when they're at their worst, and then they'll turn around. And usually about 4 or 5 days in is where you start to see them possibly needing hospitalization or a visit to the ER if it's going to happen.
Yeah.
The kids are contagious for about that time. Once they no longer have a fever and aren't really having the respiratory breathing difficulty, then they can go back to the school and have all that.
Very good.
I think those were all the big questions. Yeah. So how do we prevent it? Wash your hands.
There you go.
That's the biggest thing because we don't have a vaccine for this one.
Not yet.
So, yeah. And if you do have it, don't give it to anyone else.
Please,
Stay at home.
keep it to yourself.
Cover your cough. Wash your hands. All of those things.
Yeah.
Maybe wear a mask.
Yeah. If you do
That
have to go out.
would be a good idea.
That
at this
would
point.
be
I know
appropriate.
Not many people are wearing masks in public anymore, but this would be a good case.
The masks make the biggest difference in infection control.
Right. People who are sick.
What's the word? Keeping it from being spread by the wearer. Source control. That's it. Source
control.
Yes, that's where the masks really shine, and so that's. In fact, that was the main driver for universal masking was source control, not so much prevention for getting infected.
Right.
Although it plays a role in that, but yeah. So with that, I believe we're reaching the end of a really good show on RSV.
Yeah.
Thank you, Dr. because of all of the work you did putting all that together.
Yeah.
Appreciate that. Giving the talk.
Unfortunately, have some experience with RSV.
Yeah, really. And then we also appreciate Laura Barzyk.
Yeah, thanks for that.
Who do you want to thank? Remember, this is
So you can check out in the link below, but please go check out my post on it. It's got all the information we just talked about and a little more, and also my personal experience. A little story about my middle son who got RSV and had to be hospitalized when he was 1 month old. So I know this well, and if you are a parent going through it, it is difficult, and I have been there, so I commiserate with you. But over there, I do have some Patreons I'd like to thank. That would be Sir Lindsay Antwine and Teresia Rowatt. Thank you for what you do. You make it happen. I also thank Lindsay Antwine because of what she does for Auburn Medical Group on the Patreon called patreon.com/Dr. Vaughn. Hey, there it is. Here. And that's how she gets her name over here in a little bit, and how other people do too. Until next time. Hey, I'm Dr. Gawain Vaughn. And Dr. Mark Vaughn telling all of you to stay in good health and don't spread RSV. Yeah.
Doctors, thank you for another informative session. Auburn Medical Group is located in Auburn, California, USA. Thank you for participating. Please tell a friend and join us again next week.